If you have just joined us, my name is Piotr. I'm a journalist, and I'm joined in the studio by Piotr Popowski of Gdańsk, of Medical University of Gdańsk. He is also the head of the Polish Health Program Society. So today we'll be talking about the position of patients in the ecosystem of e-health. Piotr, tell us, what does patient centricity mean? Even the minister has mentioned it recently. Thank you for your question. I think Maria Libura is going to tell us more about it. I wanted to ask her to join us. So Maria, as one of the key players on the Polish market, she is going to define this term. So thank you very much for touching on this vital issue. I'd like to greet you on behalf of Professor Przemysław Rutkowski, the Dean of the Science Department at Medical University of Gdańsk, but he was summoned to a COVID patient, and he asked me to greet you and apologize because he won't be joining us today. Maria Libura, the head of the Polish Association of Prader-Willi syndrome patients, will be moderating the first panel today. Today's meeting is available in two language versions, Polish and English. I encourage everyone to ask questions and post your comments in the chat window. Whenever possible, we'll do our best to reply to them or send your questions to adequate panelists. So the second day of the forum traditionally is dedicated to organization of healthcare, but in patient-centric setup. So this is what we are discussing today. Patient in the center of digital healthcare. We'll be also talking about the approach to public healthcare. Will be joined by representatives of different institutions which on the European level deal with transformation in the area of health and digitization of healthcare and public healthcare. So the second session, which shows possibilities opened up by transition from reactive to proactive systems, shows far-reaching consequences of changes in the mindset and thinking about healthcare. I would like to greet students of medical universities from all over Europe. To them, we would like to demonstrate that we are putting behind 19th century paradigms of healthcare, that digital revolution will change our life forever. And it seems to me that today we are in for a very exciting day, packed with use cases, well, practical cases when some solutions were used in public healthcare. And we followed the principle, we adapt the program to our guests. We have first league players from top European teams, such as the European Alliance of Public Health, the European Society of Public Health, the European Association of Health Schools. We'll have representatives of Israel, Ireland, Greece, Italy, and fantastic Polish speakers. So, Maria, are you with us? Yes, I am. Hello and welcome, Maria. I hope you can hear me. Well, please put on your presentation, because at the beginning I would like to touch on several issues related to yesterday's address of Artur Pruszko, the director of eForum, who challenged us with some diagrams. And before I comment on these diagrams, I would like to come back and revisit a leitmotif of eHealth Forum from 2018. We called it a house built by patients. So more than 40 NGOs have come together to create a concept of system transformation we should be heading towards. So these are patient-centric solutions that we want to see implemented in real life. As you can see on the very bottom, we have health solutions, which we recommended at the time to be treated as a priority and as a way forward to implement e-health transformation. And as a result, we hope to achieve patient-centric solutions. So this was a massive contribution of Eva Borek, who was with us from the very beginning when we embarked on the journey, but we said goodbye to her, unfortunately. And Maria will comment on Eva's role in our quest for patient centricity. Okay, so I'm going back to yesterday's address of Artur Pruszek. Artur has indicated that the system of healthcare in times of digital transformation is also experiencing a crisis, and this is what we are witnessing right now. Today, we sense that something is not working as it should be. Effectiveness of the system is much lower. We all have a sense that access to services, access to healthcare is much more limited than before. And right now, a challenge for participants of upcoming panels. I would like us, while discussions continue, try to indicate how digital transformation will transform various elements of our healthcare system. Will this system built from numerous components that have to interplay, will it be altered for good and improved? Will we see this exponential growth, or possibly in some cases are we going to end up in a black hole? Well, it seems to me that an element of patient centricity is the discussion on how to engage patients, how to provide patients with solutions enabled by digital transformation that will take us along this gloomy valley to exponential growth. Maria, please tell us a couple of words about Eva, and please reflect on her role in building the patient-centric concept, and please explain what patient centricity means. Well, thank you very much for extending your invitation. Thank you very much for enabling me to moderate the upcoming discussion. Without Eva Borek, I would probably never be here today. Eva's role in defining what healthcare, which puts patient needs first, which puts citizens' needs first. From the very start, Eva did not perceive the patient as someone who needs medical assistance, but she also noticed commitment of citizens, people who are potential patients, or perhaps they are patients, who require no intensive care, but they are playing for their own health. I think she was a pioneer. She also championed patient centricity. She believed that we should not only focus on patient needs, we should also comprehend that it's the patient who should be co-creating healthcare solutions. And I think that e-health, digital transformation shown as a part of the health system, it all ties to her vision of healthcare. She was the head of our foundation, and she was also a patient because she was a patient herself. And she saw exactly how potential of digital transformation may contribute to putting patient first, and how it enabled patients to co-create the system and to regain control over his or her treatment. And I think we owe it to Eva. It's her contribution, and we are missing her desperately.